Good morning, everyone. Welcome all of you joining the public presentation organized by the Occupational Health Center. Today, the topic is about remote work and mental health, harnessing psychosocial factors that heal rather than fragment workplaces. We are so pleased to have Jeffrey Thompson, the occupational health nurse at the Occupational Health Center, to present for us. We would like to begin with acknowledge that we are on the Treaty 1 territories. The traditional territories on the Anishinaabe, Oji Greek, Dakota, Diné people, and the homelands of the Métis Nation. We respect the treaties that were made on these territories, and we acknowledge that we are all treaty people. At OHC, we commit ourselves to a process of reconciliation with indigenous communities. So for the Zoom session participation, so you could see that the host has mute and disabled video for all participants. Please keep your video off during the session. The engagement polls are a quick chance to respond anonymously to the content. To ask questions, please put your question in the chat box section on the right side of your screen, and the presenter will try to answer them in order. So we may not be able to answer all your questions in the Q&A session. Please connect with us afterwards to follow up. This session is being recorded. We will post it on the website and the social media soon later. Please now join me to welcome Jeffrey Thompson.
Good morning, everyone. Give me one quick second here. Okay. We've got plenty of people still coming in. We'll get started here. Let's see. There we go. Okay. So here's what we're going to cover today. I've got a bit of a packed schedule here. We're going to, first of all, just review where we're at today. I suspect that everyone who's checking in here, we're not living under a rock. So we know what's happening in the province with regard to COVID-19. So I'm going to touch on that a little bit, as well as some of the research on remote work. It is emerging. This is all a giant natural experiment that we've all been flung into. So there's a lot of very active research happening right now. So I'll touch a little bit on some of the early findings. And then pros and cons. So whether you like remote work or not, we've all been thrown into this. I myself am a remote worker. I just recently switched to full-time working from home, so I feel what we're all going through. And the concept here is thinking about mental health and psychological health and safety. And I've been kind of playing around with some of the language. And in this current environment where we can't physically be with each other, we have to use, I think, more perspective taking, more imagination around where people are coming from. So I started thinking of it as kind of like psychosocial mirrorscapes. That might sound a little corny, but the idea is we look into mirrors and we see ourselves, but we want to be able to see each other more clearly. And I think when it comes to mental health, when it comes to understanding points of view, it's really important to understand where folks are coming from. And I think that's where some of the compassion-based material that I've got today, where that comes from. So we'll end off with some practical tips and strategies for teams, managers, workers. There's a whole, obviously, different levels of people here. And then, of course, we'll have a question and answer towards the end. So I'm going to keep this to about 45 or 50 minutes with some time for Q&A. We might run a little bit over depending on how that goes. But just remember, this is the beginning of, I think, a conversation. It's only an hour. Obviously, this content, it's hit a nerve. We've had over 200 people sign up for this. So it's a big deal, and we definitely don't want to leave anyone hanging, and we can explore other things in the future as far as training. So this is our first question. Tiffany is going to throw up a poll. Please indicate your role and whether you primarily work remotely or in the office. I say primarily because many of you might be either part-time or you might be working a couple days out of the office. But because there's generally 5 work days in a week, 3 or 2, that usually you should have hopefully swinging one way or the other as far as where you spend most of your time. Although you could be right down the middle. You work 6 days a week, for example. Hopefully that's a lot of work. So we'll let this go for, I let it hit at about 80%, and then we share the results. Give it just a second. Okay. 48% staff or worker working remotely. Okay, that's good to know. That helps me understand a little bit more of the perspective of who's tuning in today. Next in line would be manager or supervisor who's also on remote work. So we have certainly more remote workers tuning in today than we do folks who are based in the office. Not too surprising given the topic. So let's keep going. Okay, so this is where we're at. We're in critical, and we know this. We've been watching the news. I just checked the news yesterday. As of that time, yesterday at 9:30, 365 new cases have been detected, and our positivity rate in the city is 13.5, and in the province it's 13.3. Positivity rate, of course, means the number of cases or the number of tests done, what percentage of them come back positive. And the general rule of thumb is anything over 5 is something to be concerned about. 13 is nearly 3 times that amount. And so you can see what's happening here. We had our bump in the spring. That's when this all started. And many people were forced onto remote work or forced out of work altogether. Things kind of mellowed out in the summer, and then we had a bump before Thanksgiving, and then after Thanksgiving, it just went through the roof. So this is serious, not denying that. I think the major concern here, if you're one of those people who's thinking, well, it's just a hyper flu, or it's just something that, you know, it happens. This is the natural order of the world. Pandemics are not anything new. It's just in our lifetime, in our generation, we were the lucky ones to get hit with this. The major impact here is not just of course, the tragic loss of life, but the impact on our healthcare system. So you can imagine that the hospitalization rates as well as the ICU rates are tracking the positivity rate. So that's the real concern here, is the concern on our healthcare system, as well as, of course, the people who are suffering from the disease itself. I think it's really important to understand from other natural disasters, a pandemic is affecting every corner of our society. COVID-19 has been politicized in North America, especially in the US, but also here. A lot of misinformation about what it is. Is this even a big deal? Is it something that's being made up? And so if you're already in a low trust environment, whether it's social or it's within your own workplace, it's just amplifying that mistrust. And there is a mistrust in institutions as well. And it highlights your policy weaknesses and areas where you might not have been super stellar before. And when you created a wedge and forced people out of the workplace and into a remote setting, it's just making those things even worse. And of course, now getting into some of the psychological effects, you're feeling self-isolated and alone very often, depending on what kind of support you have at home. And this is leading to chronic stress. I'm going to talk a little bit more about that in a minute and what that is doing to us. And it's creating stigma, fear, and anxiety. The other thing too is there's also this gap that's always been there, right, between knowledge workers and people who might work out in the front, you know, folks in retail, folks in plants and factories who process the food and things like that. So this is forcing a sharp lens on the people who are still doing the work, growing the food, managing the things that we need to live our daily lives, and those of us who might have more of a knowledge or education base that allows us to work remotely. So it's making that even worse, as I said, as well as the social, racial, and economic disparities. Now, remote work, what we're finding before the pandemic, if you were on telework or remote work, it was often an arrangement with your employer. It was for reasons that often benefited the worker, but also felt like a win-win for both the employer and the worker. And so often burnout rates are actually lower for folks who were in that sort of circumstance. What's happening now is things have flipped. They've flipped around on us. So before COVID-19, folks who were working in the office were experiencing higher rates of burnout than people who were off working from home because they had other arrangements. They had time to figure out how this was going to work, you know, handling the scheduling and all of that. And now it's flipped over, and on the other side, you have folks who are increased burnout rates working from home versus in the office. So this is you know, new survey data to show that this is certainly an ongoing, or it's a new problem because it's been flipped around, and folks aren't coming back to work. Nearly 3/4 of the 3.4 million Canadians who were forced into this situation in the spring, very few of them are coming back. And certainly now in Manitoba, with the rates are the way they are now, this is going to be the wave of the future, I'm afraid to say. And some sectors are managing this a little bit better than others, right? If you're in finance, if you're in certain administrative roles in government or the private sector, engineering, legal, you're able to do more of your work remotely. And thank goodness for the internet, because that's the reason this is working right now. The key here, though, is fear about coming back to work. And some of the survey data is showing that, you know, there's real concern about safety. And some of this has to do with trusting the employer to have done their due diligence around safety planning, pandemic planning, and whether, you know, the physical barriers and the cleaning schedules and all these other things that are now required in the workplace are actually being followed. Other times it's just, you know, stuff going on in your own mind. And we'll talk a little bit more about that, because even if you don't have like a concrete reason for why you don't want to go back to work, there should be some dialogue. There should be some conversation around what your concerns are. Moving on. So this might be how you're feeling right now. The majority of you who tuned in today are working remotely, and this, other than the little dog in that little picture there, households might be suffering right now. And I know we're actually in the middle of a reno at my house. So we have no kitchen, and that's starting to get a bit aggravating when you can't even prepare your meals and do the everyday things that you normally can do. So the fact is, everyone is responding to this a little bit differently, and it is affecting our mental health. And so now this is very anonymous, right? So if you wouldn't mind just giving us a sense of how you're feeling right now, if your mental health is on the up and up, if it's like, somewhere in the middle, or if you're really just not doing great. Remember that mental health can go up and down, right? There are these ways of thinking about it. It can vary on a day-to-day basis or even an hourly basis. And you can have other issues that might be more of a diagnosable kind, that might be more of a long-term concern. So mental health is a good thing. It's just when it's not a good thing, it's good to take note. It's often, we take it for granted when things are going well, and when things aren't going well, is when people tend to key in on that. So, all right, most people are like, meh. I thought about just saying, you know, some other word, but I felt like, you know, I feel that way too. I think right now we're just, some of us just might be getting by, and I can understand that. So thank you for sharing. We'll move on here. So stress theory, this has been around for quite some time, and very often it's associated with the physical response to a stressor, a problem, a hazard, something that comes out and affects you in a very severe way. Your body has mechanisms in place to manage that, thank goodness, and it fights, right? In this plateau here, you can see where if it's a one-off, you're gonna be, you know, those hormones, those stress hormones kick in, and you do your best to manage it. And this is when your immune system also goes into hyperdrive, and it increases your risk of, increases your risk of disease and illness. Certainly when you're in that exhausted phase, your body's picking up the pieces. Now what happens is we're in what's called a prolonged stress incident response. So that green resistance plateau is long, because we've been in this for months. It's not like a car accident or some other tragic event that's sudden, and then, you know, that can also cause obviously long-term ramifications. But as far as the physical trauma in that moment, it can be a shorter period than what we're experiencing right now. We're experiencing kind of a low grade anxiety that is coming out in unforeseen ways. And so in preparation for this presentation and some of the other work I've been doing, I've been thinking a bit around something called survival psychology. And they investigate why some people in a traumatic situation are surviving and others aren't. They've often thought maybe there was a survival type, or like a resilient type, or some kind of set of features, whether they were genetic or learned, that meant that these people were like superstars or super survivors. It does feed into that idea around, the Darwin hypothesis around, survival of the fittest. And, there's certain evidence for evolution, of course. But when it comes to resiliency and surviving, it's actually a set of learned behaviors. And what's happening in the pandemic is we feel the most safe when we're at home, when we're doing our routine daily activities, going grocery shopping, going to the movies, going to the mall, doing the things that we used to do on a normal basis. All of that has been completely upended. And it's hard to focus. It's hard to know, like now you have to go out into the public and have a mask in your purse, in your bag, like readily available. I know for me, my partner and I, we were going and picking up a television set of one of these, Black Friday deals, and we were borrowing a car, one of those car co-op cars, and we realized we left our masks back at the parked car, and we got halfway, across town, and we had to turn around. And so your mind's thinking like, oh, I don't want to walk into a building without a mask on, because what are people going to think? Or, so there's all these like social expectations as well that are kind of getting in the way. And that's creating a certain degree of stress. Now, what's different about survival responses is it's extrinsic in the sense that this is being forced upon you from the outside. And people who do manage these situations a little bit better are able to objectify, certainly remove the emotion from it as much as possible. But they focus a lot more on what they can and can't change, what they can and can't deal with. So rather than ruminating on things that you have no control over, think about the small things you can have some control over. And if you focus more on that, it actually helps you manage certainly your mental health and your ability to get through some difficult times. So I don't want to spend too much time on that. If I had more time, I would. But I just want to reiterate the most important piece here, and that is that you are doing the right thing by working from home. I know it doesn't maybe feel that way right now. We don't know what the future holds. You want to hold on to some hope, but you also want to have the difference between hope and faith is hope is more of an optimistic attitude, and faith is actually having more of a bedrock trust in a person or a thing or an idea. And I know for myself, certainly friends and family come in a strong way with that, but also the workplace. I feel very, very valued by my colleagues where I work, and that helps me get through some of the tough times. So I'm hoping that you have some of that in your work and certainly at home. But it's important to dig deep and understand that we're all part of the solution here. And I think this is where the social solidarity really matters. And I want to talk about this because I think this is what's getting lost in a lot of the conversation, a lot of the media coverage, a lot of kind of this background thing that the pandemic of misinformation and mistrust. And social solidarity is what we need right now. It's what's important to combat this thing. And it is the #1 public health countermeasure to COVID-19. Until there is a vaccine, you even need it to certainly vaccinate and logistically deliver that sort of intervention. But until that time, and even after, we really need to do our part. What I think is really interesting is that social solidarity, it's the cohesion between individuals in a society that ensures social order and stability. It underlines the interdependence between people in a society and allows them to feel like they can improve the lives of others. So that's the human nature that I like to focus on, right? It's not so much the need to be an individual and protect my own body and not wear a mask because it's my choice. It's because I understand that this is a responsible decision I'm making to protect other people. And so, and that's what remote work is doing. It may not feel that way, but by not going into your office, by not making those extra trips, you're actually helping the rest of us. So globally, we're really challenging with this. It's a real issue. And the thing is, there's a difference between social distance and social distancing. And I want to point that out quickly. Social distance has to do with the unfortunate reality of, with this virus, for example, it came from Asia, and so there are certain stigmas associated with that. There's racial discrimination, there's fear around certain groups of people who are more infectious than others. And so that's creating a social distance and an empathy gap between certain people. Social distancing is a public health measure. So that's the difference. So what happens is, with better social solidarity, you're able to maintain that social distancing in a more profound way. Anyway, by the way, that's an excellent book. It's quite unnerving, but I highly recommend it. I'll leave it at that. So the point is, we're investigating. Okay, so if the source is the virus, and we're trying to prevent the virus from spreading, we're eliminating the source in the terms of working from home, right? That's like the first place you want to go when you think about this from an occupational health and safety standpoint. So sometimes that's not possible. In this case, we are removing the exact hazard, which is the transmission of the virus, but we're creating other forms of hazards, and many of them are psychosocial in nature, and that's what we're going to talk about today. And that's where you look at your policies, your procedures, the way you communicate, the things that you do on an interactive basis with your coworkers happens in this yellow zone. So a lot of the work around workplace psychological health and safety, for example, happens at that point, because we all have mental health, and that's a good thing. But sometimes you cannot actually get to the core issue, and it gets complicated. Now, the thing here is, and I put a little exclamation point, because this is where the PPE, or the personal protective equipment, lands. If you work in healthcare like myself, you get fit tested for respirators, you wear the gloves and gowns and masks and things that you're supposed to. That's a given. But and you're a healthcare worker, so that's your job, right? So that's important. But other folks, like when you're working in other settings, like it shouldn't just be about slapping on the PPE and putting you in these high risk situations. It's more than that. It takes more of a system approach to understanding further upstream how we can limit some of these exposures, certainly from the pandemic and the safety standpoint. So we should never rely strictly on PPE. That should never be the first go-to. And so please don't forget, and I should have mentioned this maybe a little bit earlier, remote work may not be a perk anymore, but it's still a privilege. So spare kind thoughts and deeds for our frontline workers. So these are folks who are working hard for our benefit, and I think it's important to remember them, support them, and yeah. So that's not to say that what we're dealing with as remote workers is not also valid or equally valid even. It's just important to understand, like I said, these perspectives are really important. So we don't want certain resentment forming on one side or the other, or not really understanding what other people's experiences might be. I think it's really important that there be more dialogue there. So this is what it is. I mean, it is a choice. It's a choice collectively and personally, as well as in workplaces. How are we going to proceed here? Are we going to just throw our hands up in the air and say, well, remote work is what it is. I'm just going to muddle through it, and hopefully in a year when this settles down, I can go back to my regular job, and I'll just kind of, if your job was already fairly isolated, you had your own little cubicle and you didn't really talk to people, maybe remote work is working for you, and it's an extension of the kind of work you already had. But for many people, there's a need for more interpersonal contact and more connection. And right now we are feeling fragmented. We're feeling kind of far flung out into this very perilous world at the time. So I think that there really are strategies we can do moving forward. And I think that's where we're going to start thinking ahead. Now, people who know me, I put lots of PowerPoints together in my life these days. I don't love lots of words on the screen, but I'm doing this only because I think it serves a point it certainly helps get the information across, and in only an hour, we don't have all the time in the world. So I think these slides will be made available. I think you can PDF them, and then you can share them however you want. As I was putting these together, I realized, okay, for every like positive aspect, there's a negative aspect. It's like one for one. There's like no equally positive or equally negative thing. Now, in red, I put reduces transmission of the virus in workplaces, because that is the point. Let's not lose sight of that. That is the big deal. But then, of course, it's creating other spin-offs of stress, anxiety, and all kinds of other issues. So it's great that you're still able to work, like you have a job. You're still getting paid. So that's a very positive thing. But once again, it is, could be a negative impact on your way to manage and interact with management and coworkers. So you might have more flexibility, but then you might have issues with work-life balance and setting boundaries. It may force managers to think more using paradigms that are more around trusting you to do the work rather than having to see you do the work. They have to trust that you're doing it. Maybe they switch to being more focused on deliverables rather than hours. Or the flip side of that is the workplace doubles down and you might feel like you're being micromanaged from a distance. So once again, for folks who are maybe a little more introverted or like the privacy of working alone, or they're located somewhere far away, like in the rural areas or in the north, this has been a boon. Like this has been a great. They might even enjoy virtual training more than in-person training. They get to choose when to turn off their video or when to, participate. The flip side of that is folks who might be more needing engagement might over-engage, might become more committed and do more work, and that can affect you and lead to burnout. So other people have dug in deep, and maybe they're doing yoga for the first time in their life, or maybe they're doing other sorts of spiritual care practices and cultural practices. So this has been an opportunity for them. Other folks, for multiple reasons, might be doing less exercise. They might be eating more unhealthy foods and such. So once again, like these are choices, but they're also, you're being put into circumstances that you weren't really prepared for. And of course, family care can swing one way or the other as far as, I'm always touched by stories I hear of people whose marriages have actually been improved by bringing them together and kind of in one way forcing you to spend more time together. That can go either way, right? I mean, that can be a good or a bad. It just depends on the circumstances, right? And the relationships. But yeah. And then this is a really important one, creative use of space and environmental control. That is a good thing. That's a great thing. But that can also cost a lot of money and can be inconvenient if you have to foot the bill as the worker. That can certainly be a challenge. So these are just kind of some lists, some positives and negatives, and you can see there's no clear winner. There really isn't. I think remote work is here to stay. I think even after the pandemic, there's going to be a lot of strong reasons, certainly cost-cutting, bottom line reasons for why this might continue, but it should still come up to a dialogue and an exchange between the worker and the employer. So I want to talk also about productivity, and this is where we sometimes get in trouble. When you look at what the researchers are saying, often they're looking at it from the lens of, okay, how do we maximize productivity? And, oh yes, well-being is important too. It's almost like the well-being part is like a product, an unintended byproduct of being productive. Because in our culture, being productive, having dignity in work and feeling like you can contribute, not just for yourself and your family, but for society, might feel good, depending on what your job is. Maybe you don't feel that way about your job at all, and that's okay. But there is kind of this idea in our culture that to be productive is to have value, to have worth. And I agree with that. The problem is if that's your end goal, and if the employer thinks about it in those terms, and oh, by the way, I want your psychological health, and oh, by the way, I want your mental health to be good, I feel like that's kind of the cart before the horse. So tying high engagement can lead to rates of burnout, stress, and anxiety. And so this idea of equating worker self-fulfillment with productivity is dangerous. I feel like that certainly can perpetuate a sense of workism, which is a word. It's like alcoholism, but or work. So I'll let you make those dots, connect those dots. I think there's a better way to think about it. And I think maybe what it is it's looking at the model first, and then sure enough, you get increased productivity out of that. And so rather than focusing first on productivity and saying, oh, yes, we want you to fulfill X, Y, and Z, and here are all your benefits, and here are all your supports, and here, you know, so it's like kind of like, let's slap that all on, you know, after the fact, but, oh, I want you to get this done. So I think that what's happened in our remote circumstances is that, okay, productivity levels are up here, but all these other factors around, you know, your spiritual, psychological, physical, and emotional well-being are being sidelined. And I think that certainly employers, managers, people in charge, I think would do better to think first about well-being and then modulate productivity as needed. You know, and I know they have the tough job of looking at the bottom line and looking at their inputs and outputs and making sure that, you know, they can afford to pay you your salary. So, you know, that's where there's a bit of that shared responsibility. But most of the emphasis should be on the part of the employer, because they're the ones who, you know, push all the buttons when it comes to resource allocation. Because when you think about mental health, like, this is at the core of everything, right? And it's not something you just leave at the door when you come to work. And now that whole notion is out the window, right? Because you wake up, you go to your desk or your table or wherever it is you have your workstation, and how do you turn that on and off? You don't. And so this idea that you're supposed to just keep work or keep your life, the rest of your life, at home and keep work at work is a notion that's completely, well, it's incorrect. It's just wrong, because you're being forced, we're all being mandated to work in an environment that's blended these things together. So I think it's in the employer's best interest to recognize that, understand that your mental health is something you carry with you wherever you go. Okay, so we know remote work is the best control measure. It's not always fun. It is like getting, you know, stuck with a barrel of lemons. How do you make lemonade? And it is possible. And there's other research on resiliency, and I have kind of mixed feelings on some of that. I'll tell you, some of these words like resiliency, engagement, they're kind of overplayed, in my opinion. So I'm always like, if it's overplayed and overhyped, my antenna tend to go up, and I'm a little like, okay, maybe there's some other ways to think about this. Because your ability to be resilient and to manage very much depends on your environment. So you cannot just say, well, I'm going to be mindful and resilient and I'm going to power through, without looking at these factors that occur in the workplace. You're not going to be your optimal best self. So I think resiliency can turn into this like kind of sideshow. If, you know, a lot of wellness programming is about how to do self-care and promote your well-being, and all that's really important, don't get me wrong, but how much better would all that be if you actually had an environment that promoted that? So for those of you who have taken a course from me before or are familiar with what the OHC does around workplace psychological health and safety, Safe Work Manitoba and the Canadian Mental Health Association also promotes these ideas. These are 13 factors that are well researched. They originated actually in Europe. They did a lot of research in Scandinavia, find that they narrowed it down to these 13. We could spend all day just talking about even one of these things. We're not going to do that. I always get a little like deer in the headlights when you look at 13 and it's almost too much. So what I've been doing is thinking about how to collapse them and group them together and actually talk about those connections. I think one that's really, really important, especially right now, I'm calling it psychophysical protection. Because you notice that those were two factors there: psychological protection and physical protection. And in the world of occupational health and safety, we have focused a lot, you know, there's been a lot of blood, sweat, and tears in getting legislation passed to protect workers around their physical well-being, right? Wearing hard hats, wearing proper shoes, policies, procedures, incident reporting. There's tons of things now that employers have to do to protect physical health for workers, clients, anyone that comes into their workplace. What's been sidelined has been the psychological piece. And so when I think about the way they twist around each other, kind of like binary stars, when I originally thought about this idea, I thought, well, okay, two binary stars are kind of equally rotating around each other. Well, no, actually, astrophysics says that one star is bigger than the other, and it's just sucking energy out of the other, and then, of course, they're spinning. And that's, I think, what's happened in our sector, in our field, is that we have focused so much on the physical safety that we haven't forgotten about the psychological piece. Because you're only as safe as you psychologically feel. I mean, think about that for a minute. You're given all the correct PPE, all the correct equipment, the tools, everything to do the job. But if you have a sour relationship with your manager or the people in charge, how is that going to make you feel? Are you going to feel valued? Are you going to feel supported? Are you going to feel like they really have your back? Even though you have all of this great equipment, even if they throw all this money at it, how does that work? So the trust piece is so important. And if there is an incident, if there's a problem, do you feel like you can report that without fear of retribution? Or do you have a no blame culture? You know, healthcare has gotten better about that. You know, if there's a medication error, in nursing at least, we look at this, we look at the systems first. We look at, you know, communication patterns, like what happened before we start nailing people to the floor and saying, you bad person, why did you do that? So all of that is critically important to certainly putting in safety plans and programs together. But I think it's really critical to think that if you don't feel psychologically safe, all those other things really don't matter. And I think we've kind of missed the ball on that as a sector sometimes. So now this is my big unveil. Even my coworkers don't know this. I was thinking about how to group these things together. And I really like the word compassion, right? And compassion links together these ideas of acting in ways, listening and acting in ways that promote well-being and support, and obviously positive mental health. So I put these three here: psychological support, psychological protection, civility, and respect together. So rather than talking about each of those three independently, I'm going to just kind of group them into this concept of compassion. So this is really that interpersonal part of how we treat each other in the workplace. The next grouping I'm calling meaningfulness. And this is also very, very important. Do you have clear leadership and expectations? Do you know what the point of all of this is? Do you have any involvement and influence in how decisions are made, or how you do the work and when you do the work? And once again, do you feel valued? Do you feel like what you do really matters? So I think that is also absolutely pivotal to a person's well-being. And then the balance part, I kept the word balance because I think it's certainly with workload management and even your own professional growth and development, you have to think about how you fit that all in. And they're not really in any kind of order, but as I look at it, it's kind of like if you have the compassion piece and the meaningfulness, then the balance comes. It's certainly not something that happens overnight, and there's certainly a lot of personal reflection and things that have to go into that as well. But at the core, and where I think a lot of the tips come from towards the end of today's session, I'm going to talk a little bit more about, well, kind of they're interspersed throughout, but it's really the meaningfulness piece, I think, with remote work is finding, you know, retrenching, like figuring out if you were really interested in your job before the remote work or before the pandemic hit, how do you reclaim more of that? How do you find more kind of whatever joy you had in your job? How do you get that back? Oh, and then of course the perspectives. People are going to react to this differently, right? And this is where the power comes in. So if you're a leader or a supervisor, you have more authority to model and promote some of these ideas. And without that, teams fall apart. Let's just face it. So, and workers are going to feel like they're off to the side. So this is really, I hope the managers who are listening in today can take some of these ideas and think about how to creatively engage more of their folks. So once again, compassion. I'm going to go through these a little bit, and then we're going to end on the tips. And I think we're still on track with time. The thing about compassion, it is not, people think about that word and they think, you know, oh boy, we're going to go down some Buddhist walk, or we're going to end up in some kind of religious thing. And it's not that at all. It is really the heart of being human. It's recognizing we have shared humanity, and that suffering is part of that experience. And I think this is what the pandemic is really highlighting, is that there's suffering all around us. We just either choose to ignore it or choose to see it. It's up to us to respond. And how we respond is where the compassion. So compassion is the action. It's not even the feeling. It's the outcome. And of course, suffering is what we're trying to address. And there's actually a four-way step way to do this. And there's some really interesting organizational psychology on this. Psychologists who look at this kind of from a group standpoint. How do you, as a group, model this? How do you notice whether there's a problem? How do you interpret it in a way that's going to kind of make people turn heads and be like, oh, I didn't realize that was happening. I didn't know that was a concern. And then to be human is to feel, hopefully, a bit of that empathy, and then you start exploring ways to positively address that. So I really think this is that. I mean, this is part of hazard identification as well, right? If people are coming to you with concerns, you have to be able to assess, notice. I mean, really, it's another form of assessment. The key piece here, though, is generous interpretations. So that's holding your tongue, biting your tongue just a bit. If it's especially your concern, the concern's coming from somebody who's just a little bit too much for you right now. Withholding that blame and understanding that under all of that, there's still a human being and you might have more in common than you realize. And if you can, and this is a skill, folks. This is not something that we're all born with, okay? And you know, there are training, there's other methods. This is just the language I like to use, but you can get this in, you know, mental health first aid. You can get this in all sorts of other ways. So this is not like the only way to think about it. But it is about cultivating that presence, understanding that you're here to listen, and really caring. Now, the thing is, it's so easy to just make snap decisions, right? And you know, so this is a pre-pandemic slide, by the way. I pulled this from a coworker, another nurse at the time, who helped to develop some of these ideas. You know, don't bring your own problems to work. Well, you work at home, so your house is your work. So you know, so I really think remote work is an opportunity to reframe some of this, to be like, you know, it's more psychological. It's more about your mental state, your head space, than it is where you're working. Obviously, where you work matters, but I think if we can cultivate a sense of certainly understanding that this is difficult for everyone, and don't just jump to conclusions. Now, the other piece here, and this is, I categorize this as under kind of more of a motivational, or not motivational, meaningful heading. And that has to do with trust. We've done some other work around organizational trust. And interestingly, or not interestingly enough, it is easier to repair trust between people. It is much harder to repair trust between a person and an organization. And that is because organizations are larger, they're complicated, you get lots of different communication cues from people around whether your organization is a good organization, bad organization, whether the mission is fulfilling its what they said they were going to do. When it comes to your boss, I think that's where this really shines, is this scale, right? You may like your boss, you may think they're a nice person, and you may get along with them fine, but do they have aptitude? Can they actually follow through on what it is they say they're going to do? So I like thinking about trust in these terms, because it really is, especially in a remote work setting. It's like, do you trust that your manager, your supervisor, is going to listen and follow through? And I think it's a helpful thing to think about, kind of where maybe they're at. And part of this is, I think, some introspection on their part to remember that it's harder. It is harder to manage people remotely. I don't envy them at all. It's just it's going to take a bit more work, I think, to grow the trust. And if it was a bit damaged before the pandemic, before we were all flung out into the ether, then it's going to be a lot more work right now. So here's another question. Let's go ahead and throw that up, Tiffany. True or false? I understand what is expected of me working remotely, and I feel confident in my abilities to meet those expectations. Got 132 folks here. Wow. Okay. 81%. 87% said, okay, well, that's a good thing. Okay, well, that means a lot of the hard work, it's always hard work to do, but I'm heartened by that. Okay, moving on. So the other kind of concept here I want to just emphasize, locus of control. Where is it? Locus of control has to do with whether you feel like you're in control of your life or whether you feel other people are. And when it comes to work, I think this is where that involvement and influence piece comes in. When it comes to making decisions around how communication is handled, for example, or how work is divvied up, is it more of a collaborative process, or is it more of your boss is saying, well, because of my needs, I want, or the organizational needs, that's maybe how they would say it, I want this, this, and this done. It doesn't always feel very good. Now, some work is very much like, you know, if you're in an emergency room and something has to get done like stat, and you're in a position where you can do it and you have a person in authority telling you to do it, you do it, right? I mean, that's different. But given kind of the context, it is important to allow for some more of that flexibility. And once again, I find this so funny, the work-life balance, right? This is a wood carving. This is like from the 1800s. I found this on the internet, where the unions at the time were promoting this idea that you had 8 hours of work, 8 hours of rest, and 8 hours of pleasure time or fun time or whatever it is you wanted to do. And it seems so, I mean, even at the time, you know, the industrial era, I find that hard to believe that this was the notion, but it was a selling point, and it is part of the reason why we got weekends and why we got work hours and why we got kind of some progressiveness on that. But I would argue that it's kind of outdated. And I think certainly in a remote setting, we got to rethink this. And a lot of it has to do with your own ability to manage your own situation, your own home. And you would think that you have that more control being at home. But if you feel psychologically tethered to either your phone or your laptop or whatever your team is demanding of you at 12 in the morning, it doesn't matter what your physical work environment is. It's that tether to the psychological that's really important, or in that case, not great. So yeah, so this was just more kind of a conceptual walkthrough. I want people to understand that we're all coming at this from different angles. We all have different pressures. We all have different expectations. It is on leadership and certainly supervisors to communicate that to the folks that they manage, what those expectations are. So I'm glad that at least in the poll that we just did, there was some positive response to that. That's something that needs to be tended like a garden in terms of promoting kind of ongoing well-being. So some other points here, and then we're going to get into the tips. And I know I'm getting up to my time here, but hopefully this has been interesting for people. Then this gets back into some of that compassion thinking. Am I making assumptions about this person and their concern? If it's a coworker, you might share that concern. And if you do, why or why not? If you're a person in power or a person who's had authority and you don't understand that concern, why not? Do you have enough ability to imagine what it might be like to be in that situation? Or are you married to the idea that, well, I'm the manager and I see it my point of view and my point of view wins because I'm in charge? You know, that's unfortunately the way it goes sometimes. And then based on what I understand, what might be the root of their concern? And so that's getting into more of kind of the thinking of it from more of a hazard standpoint. And then there is a certain degree of responsibility in terms of where is my self-care and boundary setting. I know my partner works in academia and he gets thousands upon thousands of emails every day. And he gets so excited when he gets it down to like 200. And I'm like, wow, from like 2,000, that's incredible. You know, and so there's tricks you can do to empty your inbox. You can even go on like a email, what they call it, a purge, where you just say, okay, after this such and such a date, I'm clearing out my inbox. If you sent me something 3 weeks ago and I didn't respond, that means I didn't get it. Send it again. May not be popular, but if that's what you have to do sometimes to reset that boundary and communicate that to people, so be it. So he's done that. I don't know how many times he's done that, but a few times. Probably not want to. You don't want to overdo that one. But once again, there are venues, there are places you can go to talk about your concerns. These are the traditional venues that will change now in a remote setting. I'd be curious to know, not today, but if anyone wants to communicate with me later on how you are communicating health and safety concerns. Is it through your committee? Is it more through your union right now? I mean, I would understand if that's where this is at, because there might be some real issues with the way work is happening. Or are you having one-on-one meetings with your supervisor weekly or every few days, or however you have it arranged? So I'm going to just blaze through this next part. I'm running short on time. I'm sorry, folks. This is where I'd like us to be grounded. I think if you're going to grow compassion at work, it's going through these stages of noticing, interpreting, feeling, and then acting. Okay, so kind of use that as your algorithm. And I have some examples here of what might be going through your mind or the minds of your coworkers in a remote work setting, and how you might want to interpret things. So for example, my supervisor keeps calling me. So these are some of the reasonable concerns: unclear expectations, a misunderstanding around what oversight and control is, or you have a low trust situation. Or maybe the supervisor just isn't experienced. They could be young, they could be someone who they're not thrilled with this either, and they don't really know what to do. So that's a bit of an empathy exercise too. But what's not helpful is to just label, right? Lazy, unavailable, unproductive. That supervisor just doesn't know what they're doing. So getting past that and thinking about, okay, what's really, like, how can we not make this personal? How can we talk about this in a way that's not just about me? Okay, this is another one. My family needs me. I feel less available. This is probably hitting home for a lot of you right now. So because of the school situation, or because of the personal care home situation, people are bringing their loved ones into their homes and managing and caring for them. So that's going to affect their budgets. That's going to affect their existing supports and ability to manage that. So once again, how is your employer helping or not helping? This is your family time, not work time. You know, it's up to you. Or use other benefits and other sick time to manage that. So once again, not helpful, right? So if we can find a way to kind of flex the productivity expectations and the way you communicate to accommodate what these folks are going through, you'll be better off. Okay, so I'm afraid there are people who just don't want to come back, right? Maybe they have a medical or a mental health condition that's really keeping them from coming. Maybe they don't trust that the safety measures are in place, or that something else is going to happen when they get there. Like maybe there's a long history, like I said, around psychological protection, where they don't feel like they can say something. Surveys show that, you know, maybe 80% of people who have a mental health condition, they want to report that it's affecting their job, but only like 30% of people feel safe in doing so. So that's a horrible position to be in. To, like, you're expected to request an accommodation because you maybe got something going on, but you're afraid because maybe you saw how you treated somebody else. So that's a real problem. So yeah, unhelpful interpretations. You know, somebody who's just difficult, and that's how the behavior is being interpreted. And it's unfortunate that we can't use our imagination a little bit more as a manager or a supervisor to be like, you know, there might be something else going on here. And certainly when you've been in a remote situation, you're left to kind of deal with that on your own often. So once again, this could be maybe more of a general feeling that many of us are at right now, feeling like you can't connect, fear of missing out. Maybe you worked in a silo before and now it feels even more lonely. Or maybe you love it. Like I said, it can swing one way or the other. People who live alone might actually have a lot of social, they got a lot of social value out of being at work. And now that's, you know, the rug's been pulled out from under them. So that's a real thing to consider. And so once again, supervisors, you need to understand that not everyone's going to be reacting the same way, right? If somebody else seems to be doing fine, you can't assume that everyone else should just fall in line. And certainly finding distractions, finding other things to help a person isn't really helpful either. I think you need to get back to kind of where this is coming from and really exploring how to reconnect on a trust level. Okay, so this is the last question. Is there at least one person in my workplace to whom I can turn to for support in dealing with a difficult situation? Okay. I see a clear winner there. True. Or folks feel that they do have somebody. That's good. That's really helpful. That one, along with feeling like you've got ways to understand your expectations and productivity requirements, very helpful. Okay, so we are wrapping up. So I'm going to just, once again, I apologize for the lists on the screen, but I think the idea here was to make it printable for people, or you can share it. So this one's for supervisors and managers. Continually validating the need and importance of remote work. Like everything I was saying about why this matters from a social standpoint. Like people need to hear that. People want to know that this isn't just for naught, right? We're doing this for a higher reason. Once again, if you don't have really good pandemic safety planning in place, you should by now, that's a requirement. But communicate that back to your staff to say, hey, we've done X, Y, and Z. So when you do get back into your office, you can count on these new things to be put in place. Recognize signs of virtual bullying and harassment. And, you know, we could maybe do a whole nother session on that. No time today, but you know, what's going on there, right? Like, let's look into that more. Be flexible with your demands, expect that variable productivity, right? And I think it's going to take a hard look at the bottom line to see, like, how can we maintain an engaged workforce, but modulate our productivity in a way where we can keep people, still meet our mission and our goals. Like I said, that's leadership, and that's a challenge, but it's got to happen. Accommodate workers as they struggle to balance their schedules. Check in with staff frequently. Ask how the staff and the workers would like to be communicated with. So that part's really important. Creative strategies. Got a few of those coming up. Don't sit on the bad news. Be direct and timely. Okay, so transparency is key. And then promoting self-care strategies and benefits, encouraging breaks. So that's kind of a standard. That's kind of maybe why it's at the bottom of the list, but also very important. Teams. Okay, now this one's a big deal. When it comes to having meetings and sharing, okay, depending on the expectations or what it is you're trying to accomplish, keeping the video optional, I think, is important. Some people are uncomfortable with that still, and that's okay. Maybe there's a reason for them in that moment why they need to have that off. Respect that. As a person in charge or a leader, if you do have the video, look for those, you know, the tone, the body language, try and don't overinterpret what you think you're hearing. But just remember that we don't have the benefits of all of our senses when it comes to having meetings. And so there is value certainly in having video and sharing, but giving people a chance to kind of just share their feelings up front, if they're willing, is important. And as I mentioned before, I'm not going to read through all of this. You can kind of see it. Communication standards, whatever that is, be consistent. Choose a platform that's accessible for people. And then what are alternate forms? Sometimes texting is appropriate. Maybe it's not. When is it? When is it not? And then making sure that it's all working. So evaluation is important. Now, there is a term now called Zoom fatigue. You've maybe heard this. People are expected to be at these meetings on a go basis. So I would challenge anyone who sets meetings to think about, like, what is this new culture going to look like? Do we need to have a meeting for this, or can we explore some other ways to actually accomplish what it is we need to? And that might mean using Zoom, or it might mean breakouts, it might mean some other technology. And then saying thank you. That's really important. Forming subnetworks, buddy systems. Sounds like you've got some of that going on with support. And okay, so job crafting, creative outlets. This is neat. It's actually one of the psychosocial factors where it may not be part of your day job, but it could be something supportive. So for example, what I do is I work with some of the data management, the stuff at OHC. I helped create a database. I helped kind of coordinate some of the ideas around what is a service, how do we interact with our clients. So I like some of that quality stuff. Quality improvement is what I'm into, even though I'm a nurse and I do other things. Finding some avenue to grow, and that's kind of a growth and development piece, but then communicating that with your team and your manager and being like, hey, you know, in this environment, I think I can do this, and I think I can do it well. Maybe it's something about the website or something about some sort of promotional material or whatever. But exploring that can certainly be great for your mental health. Mental health first aid training is highly recommended. It's a 2-day course. The Canadian Mental Health Association are big promoters of that. So I have some links at the end, you can connect to that. Using EAP. If you have a social and wellness committee, I'd be really curious to know if people are using them virtually and what that looks like. Oftentimes people do them for celebrating birthdays. I know we have one at OHC. We used to have birthday parties and cake, and now we're mostly doing emails and congratulatory calls or whatnot. But it is, you know, so finding some creative space there. And once again, there's an explosion right now in how to do team-based learning using games, simulations, team building. There's other things we can do to pull people together. So that's actually another little area of interest of mine. I'm sure my coworkers roll their eyes when I think about talk about some of the things I've been playing around with. Last slide, or one of the last slides here, sleep. You know, these are day-to-day things you can do. Establishing safe routines, and now this may seem really obvious, but the thing is do you actually sit at your dining room table, or do you have an actual dedicated space to work? If you don't, I would really investigate ways to do that. I know if you're in like a 1-bedroom apartment, that might be really hard, but there's something, like I said, it's a psychological switch. If you can go from your home to your work space, very important. Like I said earlier, this is certainly something we each maybe need to wrestle with, but reconnecting with whatever spiritual or meaningful pillar you have in your life, whether that's a religious faith, whether that's just your family or other sources of friendship. We need this right now. We all need that. And thinking about what it is you're doing, like, so give yourself a little credit, like celebrate the things you're already doing and doing well, and then sharing that with, certainly with coworkers. Getting out into nature, you've probably heard that one before. And once again, last but not least, making sure that you're not straining any other part of your body. If you're sitting at your dining room table, at least get a good chair, make sure that you're at the right height, that your elbow's at 90 degrees, and that you're doing the proper treatment for that. And we do have Andrew, our ergonomist, who can give you tips. So this is it. I wanted to end on a quote. This is a psychologist. Her name is Marcia Linehan. She's developed some work around mindfulness and kind of cognitive behavioral therapy. And she says radical acceptance doesn't mean you don't try to change things. You can't change anything if you don't accept it. Because if you don't accept it, you'll try to change something else that you think is reality. And that's exactly what's happening right now. Like, so many of us aren't necessarily, like, we're in a little bit of denial. We don't want to recognize that this is the world we're in now. We want to deny that this disease is happening, that the pandemic is happening. And we find other ways. This is what humans do. We find other ways to try and solve imaginary problems that aren't really there. So I think it's a radical acceptance. It's being grounded in object reality. And I think the more we kind of pull in, certainly family, friends, getting good information. I didn't talk much about that, but making sure you've got good sources of information in your life is also really important. These are just some resources, like I said, stuff that we would promote for mental health at work. And these are linked into the PowerPoint. I'm not sure how that would work with PDF, but you can at least Google that and things would come right back up. Compassion Lab, by the way, is where some of that organizational psychology is happening around compassion, if you're interested. So once again, this is kind of our my last little pitch here. So the OHC, we provide workplace trainings, consultations. We work with health and safety committees. We also see clients who come in with particular health and safety concerns or an actual illness or injury. I do a lot of the education around mental health at work. So if you feel like your team or your health and safety committee or folks could use a refresher or some background on this, I'm available. Of course, we're doing these things remotely now. Yeah, so health education and promotion is a big part of our job. So thank you very much for your attention. I guess I went a little over. I guess if folks need to go, I totally understand, but we will entertain questions and answers at this time. I'll pass it off to you, Tiffany.
So on the chat box here, we don't have questions on that section, but Valerie already sharing some great resources with us on the chat. So hopefully, you know, all the other audience could look at that. That'd be great. Let me see the others question they have. No. Yeah.
Valerie had a question.
Oh, who is that on the speaker?
I'm just one of the participants.
Yeah. Would you like to spit out your question instead of putting on the chat box? I didn't see you putting anything on the chat box. It's Valerie, right?
So it's Val Wolf from OCOW. I just wanted to, I guess, if there was time, talk about some of the more, because our focus is on primary prevention in the workplace. What workplace, approaches do you recommend, Jeff, or have you seen in some of your research? I think you touched on some of them in terms of just treating a team and managing a team and being considerate in the process. I just wondered if there were any other versus just and I don't want to say just, but the interpersonal management is important, but I guess I'm trying to think of higher up in the organization. How do you put the structure and foundation together to support this type of work and the new distance workplace?
Hi, Val. Yeah, it's a challenge in an hour to cover all of it. I mean, if you look at the control pathway there, I think, yeah, that unfortunately the research is still, I mean, this is, like I said, it's a natural experiment. People are just, whether they wanted to or not, being thrown into a remote work situation. They didn't have time to prepare. It wasn't about an arrangement they had with their employer to meet whatever need they had to work. So I think distinguishing that kind of, and maybe I heard some people kind of referring that as the old style telework, and now remote work is what we're dealing with in the pandemic. So I think maybe for this conversation at least, I'll say telework was the way it used to be, remote work is the way it is now. And I think the remote work, the ramifications of remote work, and certainly the mental health implications, and what I think is going to be a twin pandemic of mental illness because of this, is just now being understood. So, I mean, to get into the actual implementation, evidence-based, like which sorts of like policy interventions would be best, I haven't come across anything yet. Of course, I haven't done like an exhaustive search. I think for us, what we've done at OHC is we've thought about like, okay, what's a virtual framework? What's a strategic framework around how we do our training, but then also how do we interact with each other? And so because we do a lot of outreach and training, thinking about like how to kind of test some of these ideas on ourselves as far as appropriate use of technology, appropriate use of communication strategies and standards and things like that. And so much of it is interpersonal, but I don't know exactly like where the lines are on terms of, too much like over management. Like, what does that look like in a remote setting? Like, it's an interesting idea. And I'm not sure. So at this stage, I think we're still like kind of flailing around a little bit, trying to figure out like which pieces of this are most important. So I'm not sure if I'm really answering your question, other than I think if it's policy related, it's about communications because it's remote, and it's about relationships. and it's messy. It's not like other forms of health and safety that I think are a little more metric based. So anyway, I'm not sure. Did you have any other follow up to that, or?
No, it's okay. No, thank you. It's just, yeah, it's just trying to think of in terms of the policy piece as well as, but I did mention in the post and then that the survey that we did in the spring showed that communication was absolutely the most important comment of the 7,000, 8,000 people who completed the survey in healthcare and non-healthcare workplaces. So I certainly agree with that.
Okay.
Thanks.
Any other questions? I see people trailing off. That's all right. I know we've got other things to do.
I saw the comment from Fragment. Can you speak of if it is advisable to share studies showing that fans of watching and reading horror, hyperfiction, and have resiliency and the lower stress? I'm mainly concerned
I didn't catch that.
About, that would be 10:40 a.m. She sent it out. And I'm mainly concerned about the potential of the trigger for some people and cause them to spiral into worrying.
About triggering people, about mental illness? Is that what that's about? If anyone wants to unmute, they can actually just speak and we can hear you.
So would you like to explain it about your question, please?
Is that person still here?
Hi, can you hear me?
Yes.
Oh, perfect. Yeah, I just, I heard it on CBC radio actually, that there was a study of people who like read or watch like horror movies or horror books, that they have more resiliency and lower stress. So it's kind of like a double-edged sword. Like, how do you feel about sharing those studies with our colleagues and staff members, since it could trigger some people, or, if they engage in that activity, it could cause them to spiral into like worrying, needless worrying.
That's interesting. I hadn't heard that. Yeah, certainly anything, yeah, let me back up. I think your question is what's appropriate to share with staff around a study or ways to maybe be resilient. I think something around horror or trauma would probably be a bad idea, only because some people might be able to compartmentalize that a little bit better and actually have, I'm nothing against horror movies or even things like even BDSM and stuff like that. That's more like controlled and based on consent and stuff like that. Like that's like different. And I wouldn't be surprised if in a highly structured kind of thing like that, that there might be some healthy ways to think about communication and thinking about, that part of it. I don't think that would be good to share with a large group, because I think that's perhaps misunderstood. I'd be curious to know kind of where the science is with that, because I think there's probably certain cognitive resilient behaviors and skills that I think go into some of that. I think the trauma or the survival psychology is really interesting, because they look at, like I was saying about that extrinsic and intrinsic aspect, that it's something that's learned, and it is not just something automatic for people. There are some tendencies in people to be one way or the other, but yeah. So for me personally, unless there's a real practical application to a study or something that would be helpful to people in a broad sense, I would steer clear from that kind of thing. So that would just be my personal advice.
So Jeffrey, can I take one more question here from Michelle? She is the professor. She said, but are there any other things that professor can do and keep in mind in their teaching and working with students above and beyond what you're just talking about today?
Oh, that's a really good question, because my partner also teaches students. And I know right now with the university and the, I guess it was the near strike that almost happened, a bit nerve-wracking. Yeah, I think what's challenging is, like, do we treat students as if they're workers? You know what I mean? Like, it's kind of maybe a philosophical question too. I mean, they're workers in the sense that, you know, they're working, and if you're a grad student, you're actually working for something, like either some sort of output, whether that's a paper or for class or with a professor in some way. So in that sense, I guess you are a worker. But if you're an undergrad and you're part of the class, I still think of students as, well, they're just different. They're special. I think a lot of this stuff applies. I think the same kinds of supports, especially around communication and expectations, is really, really important. Having a really good syllabus on that. So I think a lot of it is applicable, but I think at the end of the day, and I don't know, I don't work in the education sector directly, so I'm sure there's been some research on kind of how do you treat students fairly, but then also recognize that they have special interests and special needs, because and there's also a power differential there as well, right? And they're paying versus a worker. They're not getting paid necessarily, but they're paying for the education. So
yeah, I'll just jump in because I'm still here. That was my question. Was just, I think there are a lot of things that you were talking about, that I think will be very useful, but that's where my question came from, was the recognition that students are different. It's not like an employer-employee relationship. So, and then I know the students, sometimes they do, they may have lost their jobs, because they're probably one of the groups that have been most affected. So just trying to think, and like I've been trying to think about different ways, like you said, to think about, building in some flexibility, I think, into course expectations, offering alternate assignments and trying to make sure there aren't like any huge assignments or anything like that, anything that's going to be like a huge chunk of the grade. But I was just wondering, are there any strategies, like you talked about playing games. I was wondering if you can talk about some of the games, because I thought that might be kind of fun in a class, because I'm going to have like 3-hour seminar classes. And I thought, that might be a good way to sort of engage students and maybe just have a bit of a break and maybe a laugh in class.
Yeah. Well, I don't have like a specific one off the top of my head specifically for education purposes, but I will say, kind of on a concept level, when it comes to highly interactive and participatory stuff virtually, and I'm learning all about this because I didn't have to worry about this until recently, is explaining clearly different ways, like how you want somebody to respond in a virtual environment, like whatever that looks like. Like give them the tutorial at the beginning, give them the clarity of how to respond, not just what, but the how, because people get hung up on the technology and that can be too much to manage, and then you lose the focus. The focus becomes the technology or even the method or the simulation of the game, if it's not clearly articulated and explained how to respond. Because we all come at different levels of comfort with IT and computers. So I think, and same with students, although they're probably digital natives at this point and probably better than the rest of us. So I think that's an important kind of baseline. If you want to connect with me later, I didn't catch your name, but we can, I can share with you some other resources on this.
Yeah, that sounds great. It's Michelle Bertrand. I have a picture somewhere up here.
Okay.
Yeah.
All right. Well, and I know Tiffany has your contact info, so maybe if my email's not out there, you can connect with her through her.
Okay. That would be great. Thank you.
Okay.
I think it should be the time we wrap up the session, because it's now 10:50, right? So on behalf of the Occupational Health Center, we thank all of you who have been joining that session and staying a little bit longer than expected time. So I really appreciate that. And also we thank, Jeffrey Thompson, has been sharing his knowledge and all the information and good tips for us, how to do the remote work and maintain a good mental health issues on that. So hope all of you have a great day and stay well and stay safe. We will see you the upcoming session. Yeah, we organize. So we will keep you informed. Then the session has been already recorded. So when this is ready, I will post this up and share the link to the website or even email you with the presentation slide as well. So have a great day. Bye-bye.
Thank you, everyone.